This segment is sponsored by Pine Rest. It is Healthcare Week on My West Michigan, and our friends at Pine Rest thought this would be the perfect opportunity to talk about the job of a psychiatric nurse. We have two of them here with us now, RNs Kyle Hoffmaster and Christopher Marshall, and Pine Rest recruiter on my right, Danielle Ruff. Good to have you all here. Thank you for the work that you do. Let's talk a little bit about the job of being a psychiatric nurse. We see, I guess, the stereotypes on TV, right? But what's it really like to be a psych nurse?
It's way different than other nursing. What I love about it is that we aren't task-oriented every minute of the day. Part of our expectations is to spend time with our patients, to get to know them, to establish rapport, to build the trust that we need so that we can make a significantly positive impact in their lives.
There has to be a lot of reward in it too, because you are in their lives, building these relationships at probably the roughest patch most people ever experience, right?
That is very true. You know, we see these people sometimes at what they feel is their worst time, and one of the things that really is rewarding is the fact that we get to build that rapport with them, try to help them through that spot, try to get them situated so that they can get back out into the community.
Describe the work of a psychiatric nurse, though. You say it's about building the relationship. It's not like, you know, regular nursing, as they say. But what do you do then?
Safety is our first goal, so a lot of our time is spent implementing safety on checking patients where they're at, making sure they don't have stuff that they could use to hurt themselves with other people, establishing that rapport so that they are having thoughts to hurt themselves or someone else, that they feel comfortable coming to us and talking to us, taking care of their medical needs, doing assessments, working with interdisciplinary teams so that we can provide the best care possible for our patients.
It seems like it requires specialized training and preparation. Is that true? Did you train differently?
Well, in typical nursing school, you do a psych rotation. People either find that portion of their education something that really interests them, so that's kind of a direction that they want to go. But yeah, you learn a lot as far as different psych symptoms, different conditions, and then the ongoing things that keep popping up in the community.
And you are part of, what you do is team style care, right? And so you really are, when you work at Pine Rest, part of a care team.
Yes, absolutely. So nursing is only a part of the team. There's psychiatric technicians, there's psychiatrists, there's social workers, chaplains, activity therapists, kitchen staff,
case
housekeeping.
managers.
All working to create the best environment for
Yes.
each individual patient.
Absolutely.
Yeah, depending upon their plan. Okay, so I want to turn over to Danielle, because you are in the position of recruiting people.
Yes.
And I want to share this statistic. Pine Rest is the 4th largest behavioral health care provider in the country.
Yes.
And so when you're out recruiting, what are the benefits about Pine Rest and that you're selling to folks who may come work for you guys?
Okay, not only do we have a great benefit package, we offer competitive pay. We have a great just treatment team full of a lot of the positions that they said, the caseworkers, the social workers, the nurses, the doctors. They work hand in hand to give the best treatment to our patients.
And is there a need? You've got a big team.
Yes, yes. There's a huge need for nurses all over Pine Rest. Not only do we have our inpatient, we have our residential, we have our outpatient clinics, and then we have our partial hospital as well. And that also works with the psych-techs. We have a huge need for them as well.
I am guessing that folks can find information about open and available positions on the website?
Yes, everyone can go to pinerest.org/careers. for our opportunities.
All right, well, we have put that on our website. Theirs is pinerest.org/nursing if you're in particular interest, but we put a link to that at WZZM13.com. Thanks to all of you for the work that you do and for being with us today. Good to have you.
Thank you.
Thank you.